There are several new developments with COVID-19 and its variants this morning. Infectious disease Dr. Zain Chagla from St. Joseph's Healthcare Hamilton joins us now with the latest. Good morning, Dr. Chagla. I want to start off with some positive news that you tweeted out last night about a return to normal.
Yeah, I think we are starting to see the effects of it in the United Kingdom, where they've immunized people aggressively during their lockdown, which is why we're going to this first dose strategy, trying to get as many people the vaccine as possible. They saw 10,000 deaths averted because of that vaccine series on top of the lockdown. So, unfortunately, this is a tough time for everyone. We are going to be indoors more. We're going to be isolated more. But with mass vaccine and this effort, we are going to save a lot of lives coming down. And I think once we get everyone to their second dose, we're seeing data from Israel. We're seeing data from other places in the world where, the risk of getting COVID-19 is extremely low. And the population has huge benefits from it, that really a return to normal is possible.
Mm-hmm. And there is some benefits as well after your first shot, a few days after your first shot.
Yeah, absolutely. In the U.S., we see data suggesting about 80% protection after that first shot in healthcare workers. And again, on a population scale, we see deaths start dropping for people who have their first shot. And the more people that have it, the more people are going to be protected. That's going to have even more effects on death.
Mm-hmm. Speaking of the U.S., the Centers for Disease Control has come out now with information that they believe that the viruses aren't that easily transmissible from touch, from surfaces. Where has that changed?
Yeah, I think, at the beginning of this, we were, washing our groceries,
Yes.
we were wearing gloves, we were doing a lot of these crazy things. And we recognize that, again, that surface transmission, the virus may, you might be able to, in a lab, find it on a surface. But in reality, you can't pick up enough virus to actually infect yourself. That being said, hand hygiene is still a good option in the sense of, whatever percentage risk of it is there will be dealt with washing your hands. We obviously in this season don't want to pick up anything else that would, confuse us and need to get COVID tested for. So good in that sense. And I think still in the hospitals, high burden areas, long-term care facilities, there's still something to be said about that hygiene. Even if it is a small percentage of population, we still need to be aggressive in places where there is a lot of COVID transmission ongoing or a lot of COVID burden ongoing. But for the average person, washing every surface down religiously is probably not the biggest thing. Again, focusing on distancing, masking, good ventilation is a whole lot more important, and hand hygiene is part of that.
Right. We've learned so much as the months and months go along, right? Something I wanted to touch on as well, BC's Provincial Health Officer, Dr. Bonnie Hendry, has said that right now, we have to treat any positive case as being a possible variant case.
That's true. And in Ontario, we are now dealing in the 65% range. In Hamilton, it's about 50%. So the odds of someone testing positive today is more likely to be B117, the UK variant, than it is, the wild type, what COVID was prior to all variants emerging. It doesn't mean that the device necessarily changes. It just really means that, our buffer for things to go wrong when there's high transmission settings is really, really low. And so we really have to make sure, again, limiting our contacts, distancing, masking, doing things outdoors is a whole lot more important now, given that the odds of someone having a variant is higher than the odds of someone having a non-variant.
Right. We talk right now about the three different variants, the ones that were first found in the UK and South Africa and Brazil. Could there be others developing that we don't know? Because there's so many unidentified variants, right?
Yeah, absolutely. I think, the thing that we talk about these three countries in particular is that they are high burden countries. So they've seen a lot of COVID-19, but they're also resourced countries enough to look for these variants. And Canada is also a big country that is looking for variants amongst all of its cases. So, there very well could be in places where we're seeing a resurgence in Eastern Europe, in the Philippines, in India, where the variant may be emerging in that population because, they're not doing as much genetic surveillance. We may not know about it until it's too late. With that being said, I think there's, again, something to be said about just reinforcing the health measures. And again, none of these variants has been shown, particularly with the mRNA vaccines and even AstraZeneca to a point, to show any significant harms in terms of vaccinating. And in fact, probably more incentive to get vaccinated when the time comes to give yourself some immunity to these.
Like they say, the first shot is the best shot. Dr. Zain Chagla, infectious disease expert, thank you very much for joining us. Have a great weekend.
No problem. All the best.